So Charlene, when I make these videos, we don't rehearse or anything, and we just kind of do it. We just ad-lib it. Yeah. All right. Hi everybody, I'm Dr. Tahir from Family Pediatrics in Kenosha, Wisconsin. Thank you so much for joining us today. This is Charlene, and Charlene is one of our newest pediatric patients. So I wanted to welcome Charlene. I'm so excited to have you here today.
Thank you.
And what I'm going to do is, because I have one microphone and this microphone picks up the voice well, I'm going to put this on you, and I'm going to have you tell us why you're here and what you're doing here today, because I really want to have people know what you're coming in for and why. So
Well, I had my ears pierced years ago, but I've had some problems with one of my ears, and I was hoping to find someone who could re-pierce my ears, and I just happened to overhear a conversation of somebody telling me about Dr. Tahar. I am a caregiver for adults in home care, and it's time I do something for myself.
fabulous.
Nice something for myself. And so here I am, and he's treated me very specially. I hope to spread the word that other people come up here and feel good about this. This is a good experience. It's fun.
Okay, so the process that I do, the procedure I do is a special procedure because what I'll be doing is numbing up the ears. So we did that already. We put cream on your ears and we put a cover on there. And then Charlene did something fun for about an hour, and then she came back. And now her skin is quite numb. So she's not going to hopefully feel much. Most people don't feel much at all, but I can't really guarantee that because experience of pain is different for everybody. But with the numbing cream, it's way, way, way better than not having anything at all. So hopefully it'll go well for you.
Good, I'm sure.
Fabulous. So what I'll be doing is I'll be recording our procedure as we do this, and I want to thank you very much for allowing us to do that, okay?
Dr. Tahar. Thank you.
See, she is not just our newest pediatric patient, she's our sweetest pediatric patient.
I'm one of the few that can talk.
Charlene, if there is a lot of hair, if there's some hair caught in those, I might just snip a little bit. Would that be okay
That's
with you?
fine.
All right. It's good because I used to cut my daughter's hair for a long time.
Oh, did you?
Yeah, they're 13 and 15 years old now, and for many years I would cut their hair.
Oh.
Yep.
Well, you
So
can cut the gray.
I can cut. I'm very good at cutting the bangs and everything and layering the hair, but the back, I don't know how to do the back of the hair.
Okay.
That's pretty confusing. So I leave that up to the professionals.
Oh, okay.
This is also a little different than what the experience would be at a mall, for example, because the type of cleaning procedure that I do is a little different. It's more controlled, and infection control is better than if you were to go to a mall, for example. Okay.
Yeah. Well, I go to doctors for all my health care. So you're a
Okay.
doctor and you're taking care of me.
So that is that, and then we'll take off on this side too. Excellent, excellent. You are doing so great.
Thank you.
And I'm going to just wipe off the cream over here. And now I'm going to use alcohol pads to clean off the ears more. We're going to do everything possible to decrease risk of infection, okay?
Yes, I appreciate
Mhm.
that.
And I'll be talking to you about care instructions and what I'd like you to do for care instructions, and I'll be giving you a cleaning solution I want you to use also to clean your ears. So we were thinking here in the office that you had a special date today. Is that what's going on?
Yeah.
Yes? That is awesome.
And I want my ears to be pretty.
That is fabulous. Okay, so alcohol cleaning, and then I'm going to be cleaning with what's called HebaCleanse. HebaCleanse is a skin disinfectant and used for procedures, or can be used for procedures to decrease risk of infection. So we'll be using that, and I'll be putting that on your ears.
Wow, this is so much more than you get in a mall.
All right, perfect. So that is that, and then I'm going to clean the other side too. For some reason, people tend to think that ear piercing is not really a big thing, but it is because we're piercing a sensitive part of the body and it's prone to infection. So I think it's important to really be cautious about infection control. So using the alcohol and HEPA cleanse in this manner and using sterile technique is important. Awesome. So now we have her ears nice and clean. And now what I'll be doing is I'll be using a marker and marking where the piercings would be. And then we'll use a mirror, have you look in the mirror and see how you like them, okay?
Thank you.
All right. So the way that I position the earrings is I bisect the earlobe about half like this, and the ears are at a little bit of an angle like that. So I draw an imaginary line bisecting it. And then here, I also divide this area by 2. So approximately we're going to go right about here and divide the earlobe and the bottom of the earlobe by half. And that puts us right about here. And let's see how this looks. That looks pretty good. I'm going to position it a little differently here. Now, the piercings that you used to have were really actually in a pretty good location. And I can feel a little bit of scar tissue inside the ears. So we're not going to go directly on that, but it's going to be a little around that area.
Thank you.
And I'm going to make sure you look just perfect.
Oh, good.
Yeah. Let's see if you can use this. I'm not sure if this comes off actually. Okay. Why don't you take a look at that?
Perfect.
Perfect?
Thank you.
You're welcome. Why don't you have a seat right over here?
Thank you.
You are welcome. So what we'll be doing is Charlene had a selection of different earrings that she looked at to select, and she selected a really beautiful one, which is a princess cut 4mm wide earring. And princess cut is a really pretty type of earring because it has the prongs are set on the edges or of the stone, so it looks really pretty. All right. So this is also surgical stainless steel, which has the least chance of reaction. So you won't be getting any reactions from this. Okay. All right. This is the device that I'll be using, and these earrings are sterile. They're in a sterile package. All right, so that's what this looks like right here, okay? So when I do this, Charlene, you'll be hearing a little clicking sound basically, okay? But what's nice about this is that it's not a spring-loaded gun. Spring-loaded guns, which is what typically the stores use, can sometimes cause trauma on the earlobes also. So it's not good to use spring-loaded guns whenever possible. And they also make a loud sound, and this one doesn't. So what I'll be doing is positioning this carefully so that it's right at the spot that we drew. And so what we'll do is, do you want me to give a count to 3 here?
1,
2.
3.
Good job. There you go. So with this device that I use, it positions the earring in the right spot, and also as I press this, it puts the backing on the earring too. How did that feel? Did you feel anything?
No.
That is awesome.
Simple,
There you go. See, that's the plan.
Simple.
That is gorgeous.
Yeah, thank you.
So the backing is on also. We'll do the other side, okay?
Oh my goodness, this is fun. Wasn't going to have earrings.
Right.
First time in a long time.
How long do you think it's been?
Oh, maybe 5 or 6 years.
5 or 6 years. Okay,
Too
well,
long.
no more of that.
No more of that.
Okay, 1, 2, and 3.
No pain. It's wonderful.
Awesome, awesome. You did such a fabulous job. So the backing is on there, you see? That's really good. Now, these piercing earrings are a little special. They're the shaft down there is kind of long because sometimes the earlobes can swell a little bit with the piercing.
Okay.
So you can use these as long as you'd like,
Okay.
and they're perfectly great earrings to use, okay?
Okay.
And what I'll be doing is, first of all, let's have you take a look at yourself in the mirror and see what you think.
Oh, I like them. Finally.
You look
Finally, thank you.
gorgeous. We're going to do a little more
you.
cleaning yet, so why don't you have a
Okay.
seat?